Moin is a professor of epidemiology at the University of California's Fielding School of Public Health. She is with us this hour from Los Angeles. Welcome back. It's been a while.
Thanks for having me. It has been a while.
Yeah, which is a good thing, I guess, in some ways. The head of the World Health Organization talked about the increased number of COVID infections globally, and he had this concern about the current data. Here he is.
Data are limited. Only 43 countries, less than a quarter of WHO member states, are reporting this to WHO, and only 20 provide information on hospitalizations.
So internationally, there's a lack of testing, lack of data being collected. And here in the US, the CDC, their latest numbers show more than 17,000 people were admitted to hospital last week. That's up almost 16% in a week. But is there a similar problem here with potential underreporting in the United States, especially after the authorization to collect public health data ended back in May?
John, we have a lot of problems when it comes to data today because we don't have the same kind of rigorous reporting that we had at the height of the pandemic. But also, most people, if they're getting tested, are getting tested at home. And so those results are not getting recorded anywhere. So we really don't have any idea about the true numbers of cases. But what we do know is that we've seen wastewater data uptick. We've seen hospitalizations start to go up. So these are indicators that are pretty clear. We're seeing a lot of COVID circulating in the population, and whatever it is that we're seeing in terms of numbers of cases that are recorded, we can assume that there are a lot more out there.
And with that in mind, the new director of the US Centers for Disease Control and Prevention had this message on Wednesday. Here she is.
Look, COVID is here with us. We are going to have to continue to live with it.
And that means adapting to variants like BA 2.86, which may be more capable of causing infection in people who had previously had COVID-19 or had received COVID-19 vaccines. But Moderna announced Wednesday an updated COVID-19 vaccine generates a strong human immune response against a highly mutated BA 2.86 variant, will continue to be an important tool for protection as we head into the fall vaccination season. That's in the Northern Hemisphere. So vaccines are great and they're effective, it seems, but they're only effective when they become vaccinations, right? So is that still the weak link in the chain here in many ways?
Well, we do have a reasonably big wall of immunity built up from previous vaccinations and from widespread infection, but that vaccine can make a very big difference in terms of decreasing the probability of severe disease, hospitalization, and death. So the vaccines may be very important in particular for people who are in that vulnerable category, people who are older, people who are immune compromised, people who are living with others who have these conditions. Those are the people that are going to be really the most important to get vaccinated because that's going to provide an extra layer of immunity. And for everyone, when you do get vaccinated, it's a very strong possibility that it may prevent long COVID, which is something that we know is a serious consequence of getting infected. So I think that we'll hear from CDC next week who they recommend to get vaccinated again with this booster. But that's my guess is that that'll be those populations that will be targeted first.
Well, the US First Lady recently tested positive, and according to CDC guidelines, anyone exposed to COVID, like her husband, should wear a mask for 10 days. Here's the US President.
I explained to the press, I've been tested again today. I'm clear across the board. But they keep telling me because this has to be 10 days or something, I got to keep wearing it. But don't tell them I didn't have it on when I walked in. All right?
To be fair, the president tested negative on Wednesday. He's been testing negative, throughout this. But does he get a pass because of that? And just while we have you, what is the effectiveness of wearing masks anyway?
Well, I think that the key here is that if you want to protect the people around you, it's a great idea to wear a mask, in particular if you've been exposed. And if you've had a high risk exposure, which we assume the president has, being close to the First Lady. So my suggestion to everyone is to think about not only yourself but to the people around you. And if you're going to be around vulnerable people in particular, it's a great thing to do to put that mask on. Now, testing is excellent way to be more certain that you don't have COVID. But most people are using antigen tests now. Those antigen tests are not as good as catching early stages of COVID. But nonetheless, the president did test, so that's a better indication that he probably is not infectious. It just, a couple hours later, you could be where you weren't in the morning. So, best case, wear a mask if you've been exposed.
Voice hasn't really changed, has it, Anne? It's so good to see you. Thanks very much.
My pleasure.